There's a question that most older men wonder about, but few dare to ask. Is masturbation harmful for men over 70? The short answer is no. But the more interesting part isn't the word no. What really matters is why it isn't harmful, how the body changes with age, and the secrets that most men in their 60s, 70s, even 80s wish they had known earlier. I'm a urologist and I discuss this topic not out of curiosity, but because I see so many older men quietly worrying about their sexual needs. Some fear it's not appropriate for their age. Others think it harms the heart, the prostate, or drains energy. Many believe that because their body has changed, their desires should disappear. All of these assumptions are incorrect. The truth is that sexual desire doesn't completely vanish with age. It just changes. There's nothing abnormal about having sexual desire at 70, and it's perfectly natural if your drive decreases over time. Everybody's different, and science shows that variations are significant among older men. In this video, I will share the latest research on masturbation in older adults and the rarely discussed effects of stopping it altogether. Pay attention. The knowledge you're about to hear will change how you view your health, energy, and sexual life. Even a small adjustment can make a noticeable difference within weeks. If you want to learn how to revive your body, restore circulation, and regain the powerful sensations of your younger years, watch this video until the end. Let's begin right now. Impact number 1, physical impact. When men over 60 stop masturbating, the body does not simply adjust, but goes through clear physical changes, many of which can quietly reduce both sexual and overall health. First, circulation in the pelvic region is affected. Regular ejaculation helps maintain blood flow to the genital area, keeping the blood vessels flexible and supporting erection ability. When this activity stops, blood flow becomes poorer. The tissues may receive less oxygen and nutrients, which leads to weaker erections, slower response, and reduced sensitivity. Not only circulation, but the pelvic floor muscles are also affected. These muscles may be small, but they play an essential role in maintaining erections and controlling ejaculation. When regular activity through masturbation stops, the pelvic floor gradually becomes weaker and loses its natural elasticity. As a result, the ability to maintain an erection decreases, while the risk of urinary leakage or pelvic discomfort increases. This is why many men over 60 feel that their body no longer responds the way it used to, even though they are still healthy and active. Another important effect is the buildup of prostate fluid. Regular ejaculation helps cleanse the prostate, reducing the risk of inflammation, blockage, and stone formation. When masturbation stops for a long period of time, this fluid can become stagnant, leading to pressure, mild inflammation, and even pain when urinating. This is why many men over 60 feel discomfort in the pelvic area, while the real cause often comes from the lack of regular ejaculation. In addition, testosterone is also indirectly affected. Testosterone supports desire, energy, muscle strength, and sexual function. When masturbation stops, the level of sexual stimulation decreases, which means part of your sex hormones are no longer being activated regularly. This can lead to fatigue, lower sexual interest, weaker muscles, and a reduction in overall vitality. Although the decline in testosterone is natural with age, the lack of regular ejaculation can make this decline happen faster and more noticeably. A real example from my clinic is Robert, a 72-year-old retired firefighter. He came in feeling fatigued with low desire and reported that his body no longer responded the way it used to. After guiding Robert to restore a controlled masturbation routine, along with light pelvic massage, his circulation improved, his pelvic floor became stronger, and his testosterone levels stabilized. He felt the difference within just a few weeks. His mornings became clearer, his body more energetic, and both his desire and natural response returned. So the physical impact of stopping masturbation is not small at all. Reduced circulation, weakened pelvic floor muscles, buildup of prostate fluid and testosterone that is no longer activated regularly. These changes happen quietly, slowly but continuously, causing many men over 60 to overlook them and assume it is simply old age. However, restoring a controlled masturbation routine is not only safe, but also an effective way to maintain sexual health, circulation, hormones, and energy, which is an important part of staying healthy, confident, and fulfilled after the age of 60. Impact number 2, psychological and emotional impact. When men stop masturbating, the effects do not stop at the physical level, but extend deeply into their psychology and emotions. Many feel ashamed, guilty, or embarrassed to admit that they still want to maintain this activity. These emotions build up over time, leading to stress, tension, and anxiety, all of which directly affect hormones and overall energy. Cortisol, the stress hormone, rises when men feel guilt or pressure about themselves. Elevated cortisol over a long period will lower testosterone, reduce sexual desire, and interfere with sleep and mood, causing energy to drop, the mind to feel sluggish, and a sense of becoming invisible inside one's own body. A typical example is a 72-year-old patient, Robert. After many years of stopping masturbation, he felt isolated, drained of vitality, and lacking confidence. He shared that when he woke up in the morning, his body no longer felt sharp, his desire had decreased, and he began to doubt his own masculinity. This is clear evidence of how the quiet interruption of a regular sexual activity can slowly erode a man's sense of self-worth and confidence. In addition, stopping masturbation also affects emotional connection. Masturbation, when done naturally and in a healthy way, helps men stay connected to their bodies, feel themselves more clearly, and maintain positive emotions. When this stops, some men begin to lose that sense of connection, leading to emotional distance from their partner, family, or even from themselves. Many older couples experience this situation. They are still together, but the closeness gradually fades, creating a quiet distance that makes emotions grow cold or indifferent. This also explains why many men feel guilty, ashamed, or uncomfortable talking about sexuality. The silence, combined with social stigma, causes them to disconnect from their emotions, lose interest, and lose motivation. Studies show that men over 60, when they no longer ejaculate regularly, tend to avoid intimacy, reduce social interaction, and lose interest in daily activities. This creates a cycle: stopping masturbation, feelings of guilt, stress, lowered hormones, reduced desire and energy, continuing to stop masturbation. The good news is that these psychological effects can be reversed. When men learn to accept their natural sexual needs without feeling ashamed, positive hormones such as dopamine, oxytocin, and endorphins are stimulated, helping the mind feel clearer, reducing stress, improving mood, and boosting overall energy. Restoring intentional, healthy masturbation, combined with awareness and supportive habits, helps men reconnect with their bodies, regain a sense of joy and confidence, and reduce the feeling of being invisible or losing their value. An important reminder: sexual desire does not disappear just because of age. Studies show that many men in their 70s still maintain a regular ejaculation frequency, proving that sexual ability and desire vary greatly from person to person. Therefore, ignoring or feeling ashamed about masturbation is completely unnecessary. Instead, you should view this activity as a tool that helps you maintain a clear mind, steady energy, and a sense of well-being. In summary, the psychological impact of stopping masturbation includes increased stress, reduced confidence, feelings of isolation, loss of connection with the body and with one's partner, as well as a decline in positive hormones. By accepting their natural sexual needs and practicing safe, regular masturbation, men over 60 can restore vitality, improve emotional well-being, and strengthen their confidence, leading to a more active and fulfilling life, both physically and mentally. Impact number 3, impact on the brain, hormones, and sleep. When men over 60 stop masturbating, the effects do not stop at the muscles, circulation, and sexual strength, but extend deeply into the brain, hormones, and sleep quality. The brain, although still active, begins to lose an important source of stimulation when it no longer receives regular physiological signals, and this directly affects energy, concentration, and overall motivation. Masturbation stimulates the release of hormones and neurotransmitters such as dopamine, oxytocin, and endorphins, all of which are essential for maintaining pleasure, motivation, and a positive mood. When this activity stops, the brain no longer receives these stimulating signals, leading to fatigue, reduced concentration, and even an increased risk of anxiety and depression. Many men report that after a few months without masturbation, they feel sluggish, lose interest in activities they once enjoyed, and have a harder time connecting with their loved ones. This is not a sign of aging, but a consequence of ignoring a physiological activity that is essential for the brain. Moreover, testosterone, the hormone that drives desire, energy, and male strength, is also affected. When there is no regular sexual stimulation, testosterone levels drop faster than normal, leading to fatigue, reduced muscle mass, lower sexual desire, and an overall decline in vitality. This has a direct impact on sleep quality because this hormone is closely linked to deep sleep cycles and the body's ability to recover. Some men over 60 report that when they stop masturbating, their sleep becomes lighter, they wake up more often, and they no longer feel refreshed in the morning. A real example is George, 72 years old, who had not masturbated for nearly 2 years. He came in with chronic fatigue, reduced ability to focus, and a complete loss of sexual desire. After guiding George to restore a safe masturbation routine, along with gentle pelvic massage and deep breathing, he began to notice deeper sleep, clearer thinking, and the return of his desire within just a few weeks. This is clear evidence that maintaining regular physiological activity not only supports the body, but also revives the brain and hormones, improving overall quality of life. Masturbation also helps maintain neurological sharpness because the physical stimulation activates the neural networks involved in pleasure and ejaculation control. When these signals are no longer present, the body's physiological response becomes slower and the sense of arousal decreases. On the other hand, when masturbation is maintained regularly, this network is stimulated, helping the brain stay sharp, react quickly, and improve control, which in turn enhances energy and confidence. In addition, regular masturbation helps reduce stress, lower cortisol, the stress hormone, and improve hormonal balance. Lower stress supports better heart health, more stable blood pressure, and improved sleep quality, while also creating the ideal environment for desire, energy, and sexual strength to be maintained naturally. The impact on the brain, hormones, and sleep when stopping masturbation includes reduced dopamine and oxytocin, declining testosterone, lighter sleep, fatigue, reduced concentration, and increased stress. In contrast, maintaining a regular masturbation habit, combined with deep breathing, gentle massage, and body awareness, helps keep the brain clear, hormones balanced, sleep deeper, and energy restored, bringing a renewed sense of vitality, motivation, and confidence to men over 60. One of the biggest barriers that keeps many men over 60 away from masturbation is not physical, but psychological and rooted in social stigma. For many years, men have been taught that masturbation is taboo or inappropriate in old age. When this belief is applied, men easily feel guilt, shame, and even lose confidence. These quiet, lingering emotions affect not only the mind, but also increase stress, raise cortisol levels, and reduce testosterone, causing the body to lose energy, desire, and overall vitality. It is important to understand that masturbation is completely normal and safe, even at age 60, 70, or 80. It is not an inappropriate behavior, but a natural part of sexual health that helps maintain circulation, stimulate hormones, and preserve your connection with your own body. Many men, after letting go of old beliefs and accepting their natural sexual needs, have noticed a clear improvement in their mood, confidence, and overall sense of presence in their own body. The story of Robert, 72 years old. He used to avoid masturbation because he felt ashamed and guilty, and over time he lost motivation for sexual activity. When he learned to accept his natural sexual needs without judging himself, and combined that with a safe, controlled masturbation routine, he noticed an increase in energy, a better mood, improved circulation, and a return of sexual desire. This is clear evidence that letting go of stigma has a direct impact on both psychological and physical health. In addition, letting go of shame helps men maintain their connection with their partner, their family, and themselves. When guilt and embarrassment are no longer present, they can communicate more easily, share their feelings, and maintain closeness and happiness in their relationships, while also improving sleep quality and reducing stress. Masturbation becomes a form of psychological support, helping men feel in control of their bodies, recognize that their sexual ability is still there, and realize that they still deserve to enjoy life. Feelings of shame and social stigma are major barriers that prevent men over 60 from maintaining a masturbation routine, but they can be completely removed. When masturbation is understood as a normal, safe, and beneficial activity, men can reconnect with their bodies, balance their hormones, lift their mood, and feel more confident in daily life. This is an important step in fully benefiting from the health advantages of masturbation and eliminating unnecessary psychological limitations. Now that you understand masturbation is normal, safe, and nothing to feel guilty about, the next step is learning how to practice it correctly, safely, and comfortably. This is not about performance or age, but about reconnecting with your body, restoring energy, circulation, and hormones. When practiced with intention, you will notice the benefits from the very first time: reduced stress, increased sensitivity, and a renewed sense of confidence. Let's explore the simple yet science-based steps that will help you make the most of its physiological benefits. First, the environment plays an important role. Choose a private, quiet, and comfortable space. Make sure you will not be interrupted, the lighting is soft, and the temperature feels pleasant. If you wish, you can play some gentle music to relax and create a sense of safety, helping you focus on your body. This is an important step that signals to your nervous system that your body is protected and ready to respond naturally. Next, focus on technique and awareness during the practice. Start by relaxing your body and taking deep, slow breaths. Deep breathing activates the parasympathetic nervous system, the rest and restore system, which helps dilate blood vessels, improve circulation, and reduce stress. With just a few minutes of steady breathing, you create the ideal environment for your body to function at its best. When your body is relaxed, begin to engage with yourself. Use your hands gently, paying attention to the sensations rather than focusing only on the goal of ejaculation. Slowly and mindfully massaging the pelvic area, the penis and the pelvic floor muscles help stimulate circulation, increase nerve sensitivity, and improve natural erections. The important thing is not to rush. Enjoy each sensation and focus on the connection between your physical feelings and your mind. An important principle is maintaining a reasonable frequency. Practice masturbation regularly, but not excessively, in a rhythm that feels natural to your body. This helps maintain healthy circulation, balanced hormones, and strong pelvic floor muscles without creating pressure or stress. You can set a simple weekly routine, for example, a few times per week or whenever your body feels the need. But what truly matters is consistency and mindful intention. In addition, combining this routine with simple body care habits is also very important. Before you begin, taking a warm shower or placing a warm towel over the lower abdomen helps dilate blood vessels, relax the muscles, and create a more comfortable sensation. After you finish, take a few deep breaths to calm the nervous system and enjoy the relaxed state. A surprising benefit of practicing masturbation correctly is improved body awareness and reduced stress. Older men often lose the ability to feel and understand their own bodies as sexual activity gradually decreases. Safe masturbation helps restore that connection, increase confidence, improve mood, and create a sense of control over the body. Many men share that they feel more energetic, sleep more deeply, and become closer to their partners after just a few weeks of mindful practice. Finally, remember that safety and comfort come first. There is no need to compare yourself with the past or with anyone else. The goal is to restore energy, support healthy circulation and hormones, and build a sense of confidence, connection, and well-being. When practiced correctly, masturbation becomes a natural part of self-care for men over 60, supporting physical, psychological, and emotional health. Another important factor is being mindful and aware of your body. As you follow your daily habits, pay attention to your physical sensations, your heartbeat, your breathing, and your energy level. This helps you notice the positive changes, which in turn increases your motivation to keep the routine going. You will find yourself more alert in the morning, your muscles more flexible, and your confidence returning, not only in the bedroom, but also in your daily conversations and activities. Finally, remember that patience and consistency are the key. The results will not appear overnight, but with steady, intentional habits, You will feel your energy returning, your circulation improving, and your confidence coming back to life. When your body is cared for properly, you will notice your strength, clarity, and sense of control return, allowing you to enjoy life, feel motivated, and live each day more fully. When you understand that safe, intentional masturbation is a normal and healthy part of sexual well-being, the next step is turning it into a daily habit. This is not about performance or age, but about reconnecting with your body, restoring circulation, hormones, and energy. When practiced correctly, you will feel your confidence, vitality, and sense of aliveness return, not only in the bedroom, but throughout your everyday life. Age does not mean losing your ability to respond or losing your desire. I have seen many men in their 70s and even 80s who, through regular practice, restored their circulation, hormones, and confidence, and enjoyed greater energy, vitality, and closer relationships with their loved ones. The change did not come from medication or devices, but from mindful habits, patience, and proper care of the body. Now is the time to take action. Spend 10 to 15 minutes each evening combining pelvic massage, deep breathing, and safe masturbation, paying close attention to your body and its natural rhythm. When you do this consistently, the results become clear. Improved circulation, balanced hormones, renewed energy, and the return of confidence. If this video has been helpful, please like, share, and subscribe to receive more science-based tips for men over 60. Leave a comment sharing which habit you want to try first or any question you may have. Remember, you are not too old. You can still take control of your health and your energy, and today is the perfect time to begin.